HIV/AIDS is a big challenge, but it's 100% one that we can overcome through education and improved, safer behaviors. And if we believe that and can communicate that to our people, we can change the world.
I was working in Africa in Nigeria in 1994, and we saw our first case of AIDS. We were surprised. We tested the family, and regrettably, all of them were HIV positive.
I can recall 10, 15 years ago reading a story in the Wall Street Journal, the Asian Wall Street Journal, which, if you connected the dots and extrapolated, the population of Thailand was going to be wiped out by today.
You could be pretty blunt about it. It's a business issue. This is something that involves our employees. It's something that involves our employees' families, the contractors, the communities that our employees live in, the communities that we rely on all around the world.
But most importantly, it's our coworkers, our friends, in many cases our relatives who are being impacted by this disease.
We don't want to replace the government, the health system, but we also know that we have a big responsibility. And having educated employees and healthy employees is critical to be successful.
Chevron developed a global AIDS policy around HIV/AIDS because of needs essentially out of Africa in the beginning. We had huge operations in Africa, and we knew we needed to deal with the issue there. And we felt like we needed to develop a global policy and to treat everybody all over the world the same.
So the training was designed in order to be tailored. Each module is developed with key points, and the goal is to make sure that those key points are addressed. It will look different depending on the culture, depending on the history of the epidemic in each country, depending on the history of training in each country. So each country will be able to make it their own.
The goals, quite simply, are that everybody who works for Chevron anywhere in the world will know what HIV/AIDS is. They will understand the disease, they will understand their responsibility and the steps that they can take for them and their families to stay HIV negative.
Our main focus is on learning, educating our management team, educating our workforce. We don't have to invest a lot, but if we can have a good program to provide learning to our employees, I think that's the very simple thing that we can do, and will have a big impact.
We believe by early testing and knowing your status, that we can help prolong the lives, we can improve the economic growth, the social fabric in those countries, and we believe that's a very good reason to be involved in HIV and AIDS testing and counseling.
The training has led to people wanting to know their status. Now, that's the bottom line. I think once you get to a point where people are empowered and they actually take the next step, it says that the empowerment has worked.
A couple of years ago, we talked about the ABCs, abstain, be faithful, and condomize. We elected to put condom dispensing in our organization because it's just one of the tools that we've got that can actually help us fight this disease. We have to add 2 extra things, the D and the E. Do get tested and educate yourself. Because if you can educate yourself, then you can make wise choices.
The thing about Chevron's HIV/AIDS programs that has impressed me the most is the energy and enthusiasm and commitment of our fellow employees.
Well, what we say every time we start an information session is that nothing here is proprietary. Feel free to share it. You must share it. Everyone must be an activist. So they feel empowered. They feel like they need to pass the message on to friends and family and let them know that this is what it is and this is information that we can use and we can leave.
More than almost anything that we say in the training, more than any myths that we bust, more than any information we spread, the fact that Chevron has made this commitment to the training, the fact that the leadership is behind it, almost says more about the importance of addressing HIV and AIDS head-on than anything else.
It is only with top management interest and commitment that anything gets done, down the corporation, into the community, to the employees and to the family.
In terms of the leadership that Chevron has shown in aggressively going after developing a program that really does ensure that their employees and the employees' dependents have access to quality care, really is a remarkable event. I wish all the companies would move in this direction. It's a terrific example and model to point to for other companies to follow, but also to look in the future for public-private partnerships that really do raise everybody's boat in these settings where resources are scarce. On World AIDS Day, Chevron employees all over the world participated in events.
I would say that it really opens your eyes to the world around us in terms of the need for education and compassion around this issue.
Hi, would you like a pin for World AIDS Day to show your support?
Especially to get involved and take the training course that we offer here at Chevron. It's very worthwhile and very enriching.
Chevron is partnering with Coca-Cola because both companies are involved in fighting the HIV scourge. The promotion, which is going to be run throughout all our Star Mart shops, is that for every 500 ml Coke or Coke Light bought in these shops, 15 cents thereof will be donated to the Desmond Tutu HIV Foundation.
Recently, we had a carnival selling used material from people's homes. And this was to sponsor a monastery close to the office that takes care of HIV-infected people. And the company matched the donations that were raised.
ขอบคุณทุกๆคนโดยเฉพาะองค์กรในระดับผู้บริหารระดับนโยบายที่ให้ความสำคัญกับการช่วยเหลือวัดป่าน้ำพุในครั้งนี้นะครับ
We partnered with Corporate Gifts with a Conscience in South Africa because we wanted to be able to help people who are HIV positive and in turn showcase their talents and their crafts all over the world.
We've actually been very lucky and we've had lots of Chevron projects this year that have been sustainable to all the groups.
It's a blessing to have something like this that when we are in townships we have no income. But when we do like the orders like the one that we did for Chevron, we managed to create an income for all those people who are in the township.
Equasi is a centre that looks after children as a daycare centre. Then it has women doing crafts that create employment in the area. A lot of the women that are here are shunned from their communities because a member of their family has AIDS, so we need to create employment and a safe place that they can come to.
Because of Equasi, I'm working because of Equasi. I had no skill, but Equasi helped me through with it. It's not just me. Many of us were helped here.
Chevron cares that I care about the people around me, not only our employees, but the whole community. And we can make a change just providing information of people how they can understand and prevent the disease. I think it's a great program.
It is about life and death, and it's about life and death every single day for many of our colleagues. So my hope is that in the near future, we'll no longer talk about HIV/AIDS as a life and death situation. We'll be in a world where we understand how to prevent it, we'll have effective treatment, and ultimately be able to cure it.
I wish that everybody in Chevron, all of our 56,000 employees, and then probably 2 times that number of contractors, and then 3 times that number of families, all could benefit from the knowledge that we have and the time of training and the prevention techniques, the knowing your status. If just that group of people could be influenced, and I think will be, by efforts that we put into it, that would be a huge wish and a huge success.